Hello and welcome to Health Professional Radio. I'm your host, Neil Howard. Glad that you could join us for another segment. We're going to be speaking with Dr. Mari Kurahashi. She's joining us here from Stanford Children's Health to discuss helping kids and teens cope with anxiety while returning back to school after a year of online learning, managing mask requirements, catching up on lessons, re-engaging with friends, or making new friends while trying to stay safe. Welcome to Health Professional Radio, Dr. Kurahashi, and thank you so much for taking the time.
Thank you for having me. It's great to be here.
Well, what is your area of expertise? And talk briefly about your role at Stanford Children's Health.
Sure. So I'm a pediatric psychiatrist and a clinical associate professor at the Stanford University School of Medicine. I co-direct the Stanford Parenting Center there, and I'm also the director of the Mindfulness Program. And I'm also the co-section chief of the General Child Psychiatry Clinic, where we specialize in really the whole range of childhood psychiatric disorders, and especially what we call externalizing disorders, where children struggle with impulsivity, hyperactivity, aggression, as well as mood and anxiety challenges.
Now, obviously, this COVID-19 pandemic has exacerbated many of those problems for our teens. There's so much going on in school, not the least of which is just keeping them safe, let alone getting them there and keeping them there, but keeping them safe while they are there. You know, kids do what kids do. How much of a psychological toll is this back and forth because of the pandemic taking on our children?
Yeah, it's been such an incredibly difficult time for families, parents and children and teens, and so it's a mixed combination. On one hand, we've had an ongoing mental health crisis in the U.S. for quite a while, pre-pandemic, and certainly all the stress of the pandemic has exacerbated things in the context of the severe ongoing shortage of qualified mental health clinicians, and at the same time, it's really important for parents to remember that children are incredibly resilient and very adaptive to change and stress. And so parents can have such an important role in how children perceive their experience. And so it's really important for parents to really be focused on how to foster resilience in their children. And some of the ways they can do that is to help create a strength-based narrative about the pandemic, and kind of really talk about how it is difficult, and really support the challenges that the children speak about, and also frame it as how it's helping children grow in the developing and using coping skills, and how it's brought the family together in moments of challenge, and those kinds of a more strength-based narrative about the experience can be really helpful in how their children perceive and experience what's been happening. It's also important for parents to strike this balance of really being supportive and interested in how their children are doing, while also being really thoughtful in not planting any really anxiety, heavy thoughts. So, when parents should certainly be checking in with their children about school and how they're feeling and all those things, but how you ask the questions even can be really important. So instead of saying something like, oh, this is going to be a really tough year, oh, it must be so hard, instead it's more neutral, it's more exploratory. Like, oh, how is school going? Things like that, and then following the child's lead and how they answer.
You spoke about challenges. We've all been seeing in the media many of the challenges with the mandates, mask mandate, vaccine mandates, testing, social distancing mandates. With so many parents having problems with these mandates, would you say that our children are dealing with these issues better than their parents, or are their parents compounding some issues for these kids as they return to school?
That's a great question. Again, I parents really have such a huge role in how their children are going to respond to things. So certainly if children are hearing their parents have strong negative reactions around the mandates, that can often then impact the children's experience as more stressful and can certainly make a child have more of a negative reaction to things. Whereas if a parent is really, it's understandable for parents to have all kinds of reactions to what's going on. And at the same time, if the school mandate is what it is, and this child is going to need to follow those things to go to school, and the parent wants to support their child's transition to school to be as smooth as possible for the child, then the parent being really thoughtful of what the child overhears, what's communicated to the child about the mandates, and trying to just be really neutral about those things in front of the child can really help a child then just kind of be more accepting of, going to school involves a lot of rules, pre-COVID, and most children are able to follow them especially when parents have an aligned, sense of kind of being very matter of fact of, well, this is the rule, this is what's keeping you safe. Those kinds of things can go a long way.
How different is the treatment approach for that student who was, not the greatest student in the world in the first place, and now they're having problems due to online learning? But what about the straight A student who is now a C student because they're not in school?
Absolutely. So it's a balancing act, like everything for parents, where parents can be really focused on the effort that children are putting in and being really supportive of. It's a transition back to school, and it's the transition to be in distance learning, and change can be difficult, while also being very clear about how the child still needs to be really putting in effort in a way that's reasonable, and to be really being positive about the efforts that the child is showing rather than necessarily the outcome. And at the same time, the grades can reflect how the child is doing. So it's important that parents monitor those things, especially during this time of so much change in school. And lots of children did unfortunately fall behind last year. So it's this balance of what the parents needing to monitor and check in just to make sure the child is adjusting back, and check in with the teachers, especially if a child has struggled academically historically, or if they really had a tough time with distance learning. But the message being to the child, though, that it's not about the grades in itself. It's more about parents just wanting to make sure they're adjusting back and getting the support that they need to adjust back and catch up.
When should I refer my teen to a psychiatrist such as yourself?
It's a great question that we get all the time. So this transition back is a big one. And so it's totally understandable for lots of children and teens to have a bit of a bumpy transition back, to be getting used to in-person school, both socially, academically, probably a change in routine, being away from their family after being together for so long. There's some symptoms of regression or mood changes or, not wanting to go to school. Those kinds of things would be normative and expected. When it would become more concerning, where it would be probably helpful to seek some mental health support, would be if those symptoms continue for weeks at a time in a sustained way after school is resumed. And certainly if the symptoms impact the child's functioning, where a child, really isn't able to get to school, or it's causing an extreme amount of stress, again, in a sustained way. And also, if parents notice that their child is no longer interested in things that they typically really enjoy. If they're really withdrawn socially, those would be some red flags.
Give us a website where we can learn more about coping with our kids and teens as they transition back to school, and Stanford Children's Health, if you would.
Oh, great. Thank you. So the Stanford Parenting Center has a website where we have a lot of free resources that are really targeted to supporting parents during COVID and beyond. So the website is stanfordchildren.org/SPC, as in Stanford Parenting Center.
Well, Dr. Kurahashi, I do appreciate you joining us here on the program. Thank you so much.
Thank you so much for having me again.
You've been listening to Health Professional Radio. I'm your host, Neil Howard, in conversation with Dr. Mari Kurahashi. Audio copies of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes, listen in, download at SoundCloud, and be sure and subscribe to our YouTube channel at youtube.com, Health Professional Radio.